My name is Lana Gonzalez. I'm currently a grad student studying to get my master's in school counseling with licensure. So eventually, hopefully I can have my license to do professional counseling. I am a graduate of Kutztown. I graduated in 2018 with a degree in psychology, and I'm from Allentown, Pennsylvania, so not too far away. I would say for the past 10 years, I've dealt with anxiety and depression in different ways, and I honestly didn't really know that's what it was. My parents got divorced when I was pretty young, in second grade. And looking back now, I know that I should have gotten more help, but I declined it when my mom asked me. I can honestly say though, like I didn't realize what I was going through until I look back. And the same goes with my anxiety. I had my first panic attack when I was on a school trip in Miami when it was 2014, and I had no idea what it was, and I thought it was like a health issue, something wrong with my heart, because a lot of the symptoms of anxiety or panic attacks are actually pretty similar to heart attacks. I had a pretty good childhood. I was able to see both of my parents. I took dance classes, I did competitions, I had good grades, and I appeared to be happy, but I wasn't happy, and that's why it's kind of surprising, and I think a lot of people hide it, and they're good at hiding it, and you just never know what somebody's going through. I was just so unhappy, and people would ask you like, oh, well, like why? And you just don't really have one single answer or one main thing that bothers you, and that's something that I think people don't understand. You know, there's not always a why. It's just that this is how I feel, like this is what I'm going through in my head. And I think that's why people are afraid to seek help, because they're like, is this actually a problem, or am I just like, is this just hard? Like, this is normal, you know, everyone goes through this. I again was continuing to go to counseling here at the counseling center, and I began taking medication, and the combination of the two is the most effective form of treatment, they say. And it was just a whole other world in a few months for me. I was genuinely happy just like that. So I went to see my doctor, and so this was like it was like a follow-up or two after she had prescribed me medication, and she walked in the room and she was like, she told me that I lit up and like I looked so happy, and I always remember that because I felt really good for like the first time in a long time. So I feel like that's when it really set in, that wow, like I can see an improvement and I definitely feel better. When I feel like I'm regressing or having negative thoughts again, I kind of think back to that moment and that appointment when my life totally changed, because the appointment prior, you know, I was filling out a depression survey, and like my numbers were pretty high. It was pretty obvious that I had all these different symptoms that fit. So, you know, comparing that to the first appointment and then, you know, that appointment where I was able to see improvement, is just, it makes me really happy. We don't realize how important mental health is, and we're always focused on physical health, you know. I broke my ankle. It's the same thing, and we have to pay more attention to it. Mental health is just as important as your physical health.